Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery. Welcome to Bellissimo Live, and today we're going to talk about abdominoplasties, or the common term for tummy tucks. And today I have Pam, one of our master nurse injectors, here today to give her story. So Pam is almost 7 weeks out from her tummy tuck. And so I wanted her to kind of give everybody her story, some ideas of what spurred her on to do this, how was it, and just to take everybody through and answer some of the most common questions that I'm seeing in consultations. So welcome, Pam, back to Bellissimo Live. So tell us basically, why a tummy tuck? What kind of transpired that you wanted to do this, and kind of give us your story about it.
I've been contemplating doing it probably for a few years. After consulting with you, you recommended to do liposuction first, which we did quite a few years ago, 2018. And then I started on a journey about a year ago that I just, going through problems with menopause and weight gain and so forth, I wanted to get the weight off and then to see what our next options were. And at that point, I just, from having a C-section from my child, that I had an issue with my lower abdomen, that I just wanted it gone. So my goal was set about a year ago, and we did it in August, and it's probably one of the best decisions I ever made.
So a couple of things that Pam touched on. Number one, menopause can really be a problem for a lot of women. So with that shift in hormones, what we're finding is a lot of ladies are coming in with now having some fatty tissue now that is in areas that they never had before, or in some areas now it's kind of gotten more problematic for them. So when I evaluate patients, especially for body contouring, I usually tell them this about a bell-shaped curve, and so 25% on one end only need liposuction, 25% only need a tummy tuck, but there's about 50% of people in the middle that could really use a combination of both. And so when I evaluate a patient, I kind of look at how much fatty tissue do they still have versus how much extra skin they have. And so a few years ago, you had a little bit more fatty tissue than extra skin. And so at that point, it's probably better to either debulk that area, and then allow that skin to retract. Sometimes the skin retraction, you don't need to cut it away. But in many times, you develop some extra skin, and you need a tummy tuck to sort of contour that better. But the good thing is, when you have more skin than fat, the tummy tuck is really a great procedure. When you have a little bit more fatty tissue than skin, then the liposuction is the better treatment. There's also the question is, why can't I do lipo, or what's called today lipo 360, and a tummy tuck? And it really has to do with blood supply. So I explained it to the patient that the skin of the abdominal wall and the fat of our abdominal wall gets blood supply from two areas: the blood supply coming through the muscle, and also the blood supply coming underneath the skin. So when you do liposuction, it can possibly interfere with the blood supply coming through the skin, which is okay because that's only temporary, and you still have enough blood supply coming through the blood vessels coming through the muscle. So it's not an issue. When you do a tummy tuck, you disrupt temporarily the blood supply coming through the muscle, but you leave the skin blood supply intact. But when you combine them, you run the risk of taking out both blood supplies. So the skin that you now stretch down to the bottom for the suture line may not be getting enough blood supply, and you can develop necrosis or death of the skin, and then it opens up. So I don't like to do it that way. I think it's risky. So it's usually I will do the liposuction first and then see how the skin heals, and then like in this case, and it doesn't have to be 4 months, 6 months later. It could be several years later. But Pam's done such a great job over the last year of really keeping that weight off, really, honing that so that her weight, not only just the number is even and steady, but also the fatty tissue that she has is at a minimum. And so we really dealt with the skin in this case.
At some point, I feel like as we age, the elasticity just never really comes back. So
especially after menopause. And
yeah.
so
at some point, I think everybody gets to that point, like, what do I do? No
mhm.
matter how much weight you look, you either look square or you just don't see the shape of the body anymore. So that was, I felt like my choice is to do that, and I'm very satisfied with the result. I feel like now I feel feminine again, like you have that shape back, and
Right. Yeah.
it's getting there.
And the thing is, even when you're exercising, the skin doesn't respond to exercise.
No.
The muscle does, the fat does, but skin doesn't respond. It really, at that point, depending upon your age, depends upon your genetics, how much elasticity you have in your skin, and really how much it's going to sort of redrape. So in your case, you had done everything to prepare for it, and then we talked about what the tummy tuck would do. The length of the scar. So tell us, one of the concerns that men and women have is that scar's kind of long. It usually extends from hip to hip, but tell us about it's usually low enough.
It's low, and I had a C-section scar there as well, which is now gone, but I don't feel like it's any more intrusive than what that scar was, and being so low that I feel like in any attire, I'm not going to be able to see that scar.
Right. So now let's get to the good part. Going into surgery, what was it like? Because what I find, patients will come in and say, I've heard that tummy tuck is the most painful of the surgeries that plastic surgeons do, and I don't find that to be, in my practice, I don't find my patients complaining of that. So let's hear from Pam, and I didn't prompt you before this, but so tell us about what it was like, through the surgery, immediately post-op, and kind of in those first few days.
I prepared myself for the worst. I felt like I compared it to a C-section. And then I also was thinking about when I had liposuction, and liposuction was much harder of a surgery to recover from. The first 2 days were a little uncomfortable, and the pain medicine was required. But after that, I really don't feel like it was that bad. I mean, it's a surgery, and you have to just relax and recover from it, but it really wasn't bad. I didn't feel like I had pain past the first 2 days.
Right.
Like I had discomfort and
you feel tight,
but I didn't really have pain. I didn't need to take anything for pain. It wasn't that overwhelming.
So I think one of the things that patients are worried about are also the drains.
Yes, I had one drain for 5 days, the other drain for 10 days. I don't feel that they were an issue. I know they've come a long way as well, because other people that I took care of that had drains before, I felt like the metal part or the bottom was metal. Now that's not the case. It was comfortable, it wasn't uncomfortable, but I didn't feel like it was an issue. The site got a little tender if you laid on it or if you turned, but other than that, it was not a problem at all.
Right. So the drains that I use are more round, so they slide out. So in the past, there are older drains and those they were uncomfortable coming out, but that's why we don't use those. And these drains actually drain better. So most patients are in. The drains are usually in 5 to 10 days on average, and I call them necessary evils. But once they come out, you actually feel pretty good. You can actually shower with one of the drains in. So the first post-op visit, we take out one of the drains and take down all the dressings, and you can shower with the other drain, so it can kind of go with you. How many weeks were you off of work?
12 days. Probably a few more would have been a little better.
Yeah, exactly. So, and that's right, even though it hurt me, 12 days. But again, so depending upon what you do, so if you're going back to a sedentary job with a lot of computer work, even then, 2.5 weeks, I like you to be at least 2 weeks out. And so with Pam's busy schedule, and she, and she's young and she's otherwise healthy, we got her back in 2 weeks, but that first week back is a little bit of a struggle because your body's still really in that really acute post-op period, and you really need the energy. So once we got you through that, or you got through that 3rd week, you started feeling more like yourself.
Oh yes. The first day was tough, but you told me to do it slow, so we kind of, like a soft coming back. Like I had the whole day that I was there the whole day, but I did probably half the patients. So I do a couple rest, And it did, it wore me out, like,
Mhm.
you know, it wasn't an easy day, but then each day I felt like my strength got stronger and stronger and got easier and easier, so.
Compare it to your C-section.
Well, there, I believe it was a lot harder because of the muscle structure, like that
The
was.
C-section was
yeah,
harder.
the C-section was so much harder. And then you have a child to take care of at the same
Right.
time. I just have myself and these strains to take care of.
Yeah, and I didn't think about that either.
Yeah.
But that's really what most women find. If you've had a C-section, this isn't anything like that.
Yeah,
Most women,
much easier.
just like you said, you feel tight because we tighten the muscle, and you just feel uncomfortable, but it's not really excruciating pain. Once you get through that first 2 to 3 days with any surgery, everything sort of resets, and then you start to feel better. And when did you feel comfortable, you know, just getting up and kind of moving around the house? Not outside doing stuff, but did you ever feel like you were sort of bedridden at all?
I never felt that. Even I was in a recliner the first 2 days, and I would like rest, and then I would get up and do like a couple laps just to kind of like get the circulation going, and just I felt better doing that. And then I would lay back down and rest for a few hours and get up and do another little walk. I even out on the deck to get some fresh air. My neighbors were talking to me. They're like, "What are you doing?" And I'm like, "Well, I feel fine.
Yeah.
You know, it's tender, it's sore, but I feel okay, and I just want some fresh air."
Yeah, and that's what I find is that once those first few days are gone, it's almost you have to hold the patients back from trying to do too much because it's really not that uncomfortable. And the problem is the more you do, the more fluid you make, so the drains keep putting out more fluid. So you can extend the time that the drains are in by overdoing it, which we talked about a lot, you know. But that's kind of showing you it's not, you're not down and out,
Yeah.
you're not bedridden by any means, but you still have to remember it's a big surgery and you have to let your body heal. Now we're out, 6 going on 7 weeks, and from an energy level back to, do you feel like you're sort of back to yourself?
I do. I feel like I can do everything that I did before. Just the area, I'm cautious that I don't bump anything, but I feel totally like same energy, I can get through my day without feeling exhausted. I feel normal again.
Yeah. So, and that's sort of just how we heal. We heal with scar tissue. So the first 6 to 8 weeks, which is right where you're at, is when your body has all of the scar tissue in place. So your energy level is higher now because you're not spending energy making scar tissue. And then what will happen after that is that scar will start to soften. It'll start to fade. You'll actually, even though everything looks great, you still have some swelling. That will go down. The contour will improve. And you'll just feel better and better as time goes on. But the key thing that you said before was you feel feminine again. You feel like you got that shape back that, just sort of over the years and pregnancies and everything else was not there. And so, you feel comfortable wearing whatever you want to wear now.
Yes, I do. And I'm getting compliments like of all my clients. Like they're noticing now.
Mm-hmm.
They're saying something to me.
Yeah.
They're like, something's different. I don't know. You just look different.
Right. And you have your energy back. I told you that you have that glow back. Your eyes look great, and everything's sort of back to normal. So, did you do anything special or any diets? Did we have anything going on special afterwards?
No, I actually prepared for the surgery. I prepared food just because I wasn't, sure who was gonna all be there to help me. Made sure I had lots of vegetables and fruit in the house if I was, but I ate normal. I never felt any issues like nauseous from anything, and I felt like I could eat normal. And I just wanted to make sure I was getting everything I needed for the healing process.
So the key thing is, and the reason I ask you that is because a lot of patients will say, do I need to be on a special diet? Do I need to increase vitamin? And you really don't. As long as you're eating a good diet, and one that you had probably going into surgery is enough, that you don't really need to do anything other than normal diet, normal pattern. The key thing is giving yourself time to heal, whether that's time off of work, time, things around the house, you know, the usual chores that you do. You really got to ratchet that back and just sort of feel it out. Now, at this point, you're at a point where, you know, I give patients just the blessing to go do what your body lets you do. I don't have any further restrictions physically, so you can run, jump, jog, climb mountains. You can do whatever you want. Now, you're not going to be ready to do a lot of that stuff yet, but for the most part, you can get back to all of your exercising. You're not going to damage anything, and that's another concern, is that if I do this, is the incision going to open up? And so at this point, that incision is as solid and as strong as it'll ever be. So what I usually say is feel your body out. You know, you can go back to doing yoga and Pilates. You may not be able to do all of the poses, but you can ride a bike, you can go for a run, things like that. Start slow. You haven't done it for 6 weeks. Your body's a little different now, so you just sort of have to allow your body to sort of guide you in what you do and how quickly you get back. But even if you sort of had a, you know, the weekend warrior and kind of go out, you're going to be really sore, but you're not going to damage anything at this point. So
I want to add to the lymphatic massage. That was very helpful. The timing of that, and just kind of like also seeing where you are in the process, the feedback from the massage therapist as to how I was doing, you know, how things felt, and I felt that was very relaxing and very helpful.
Good. How many of them did you have?
One so far.
Okay.
I have another one scheduled in a couple weeks.
Yep. So we usually start those a couple of weeks after surgery. A question I was asked today is, why don't I do them earlier with patients? And it's because usually in the first couple of weeks, you're still getting your bearings. Your skin feels a little odd.
Yeah.
You're just not yourself yet. You're getting there. So a lot of times you don't want people sort of touching your skin too much. So I think just taking that time. At the end of the day, it's not going to make much difference from a healing standpoint to do it in the first couple of weeks versus 2, 3, or 4 weeks out. You're still going to get to the same process. What they do is they help break up some of that swelling in the tissue itself, and so you drain better. But I want patients to enjoy it, and I don't want it to be something that, you know, you're worried that they're going to touch an area that's a little too sensitive. So now you look forward to the next one, and you said how much better you felt afterwards.
Yes. Yeah, I hydrated well before it, and I some people say they feel a little uncomfortable after, or, you know, they feel funny, but I felt totally fine. I felt like it was good. He said I didn't have a lot of scar tissue there, so I just continue doing everything that I'm doing. So
good. So if anybody was asking you, what's 1 or 2 pieces of advice that you might tell them about if they're thinking about a tummy tuck?
I'd say go for it. I prepared by getting a shower chair, just so when I was able to shower, that I wasn't standing up in a shower, and especially a steam shower, just to kind of sit, let the water hit you. That I think was a good preparation. And also a raised toilet seat, so that had handles, so that way I could lower myself, because you're so bandaged up at first, and the tightness there, that I didn't have far to go up and down, and I was on one level with a recliner. And that was just for 2 days. I mean, that's all I really needed.
Good. Yeah, that's good. I didn't even think about the raised toilet seat with the handles, but because that can be.
Yeah, you don't want to be up and down too much.
Yeah. Again, you just have to let yourself heal. So, but that's great, and I just. You know, anybody that's thinking about it, I mean, I hope this helps you answer some questions, kind of give you the idea of what the healing process is like. So if you have any questions, please let us know. You can always contact us here at the office, social media, use our website. But thank you for joining us today, and we'll see you next time.